Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, MET exon 14 mutations in non-small cell lung cancer are associated with advanced age and stage-dependent MET genomic amplification and c-MET overexpression by Awad et al. My name is Robert Doble, and I am Associate Professor of Medicine at the University of Colorado School of Medicine in Aurora, Colorado. My oncologic specialty is thoracic malignancies with a focus on oncogene-targeted therapies. This study describes the testing of a large number of tumor samples for mutations that generate splicing and loss of exon 14 in the MET gene. This alteration was first described by Drs. Patrick Ma and Ravi Salgia in 2005, with additional work by Dr. Kong Beltran and colleagues in 2006. The loss of exon 14 leads to high MET expression by loss of a negative regulatory Sybil binding site in the juxtamembrane domain of MET. This study evaluated 6,376 tumor samples, including both solid and hematologic malignancies. 1,141 lung cancers were analyzed, and these were predominantly non-squamous, non-small cell lung cancers, which comprised 933, or 82% of the lung cancer cases. The 28 tumor samples that harbored MET exon 14 alterations occurred exclusively in the non-squamous, non-small cell cohort of 933 patients for a frequency of 3%. As only 132 squamous cell lung cancer and 41 small cell lung cancers were included, it remains an open question whether this oncogene may occur less frequently in these histologies or in other tumor types, as the representation of other tumor types in this cohort was not described. These results suggest that at the current time, routine testing should be focused on lung cancer patients. One notable finding was the high frequency of MET exon 14 alterations in pleomorphic or sarcomatoid histologies, where 4 of 15 tumors, or approximately 27%, harbored this novel oncogene. Although small numbers, a similar frequency of 22% of pulmonary sarcomatoid carcinomas was recently demonstrated to have MET exon 14 mutations by Dr. Liu and colleagues in a recent JCO article earlier this year. Collectively, these data suggest that MET exon 14 alterations are common in this rare and difficult-to-treat subtype of non-small cell lung cancer, and that patients with this histology should be prioritized for MET exon 14 testing. Analysis of clinical characteristics found a statistically significant association with older age compared to other oncogene subtypes, but because there was a large range around the median, this is unlikely to be helpful in selecting patients for MET exon 14 testing. Analysis of clinical characteristics found a statistically significant association with older age compared to other oncogene subtypes, but because there was a large range around the median, this is unlikely to be helpful in selecting patients for MET exon 14 testing. Similarly, sex and smoking status of the patient are not sufficiently distinct to include or exclude patients from testing. This is an important point, as previous studies have demonstrated that biases surrounding clinical characteristics regarding age, sex, and smoking status can exclude patients from the significant benefit of oncogene-targeted therapy. There was significant heterogeneity in the type and location of MET mutations observed in the tumor samples, including point mutations and deletions that span exon 14 as well as the preceding and subsequent introns. In order to detect these mutations over a relatively large genomic area, capture-based next-generation genomic DNA sequencing, as was used in this study, would be an effective way to efficiently detect these genomic alterations. Alternatively, newer methods using RNA-based sequencing would likely also be an effective test for the loss of exon 14 in messenger RNA transcripts. The authors demonstrated that MET fluorescence in situ hybridization, or FISH, detected MET gene amplification in approximately half of the stage 4 tumor samples harboring MET exon 14 alterations. Interestingly, MET gene amplification was rarely observed in stage 1 through 3 tumor samples that harbored MET exon 14 alterations. These data suggest that MET-FISH is inadequate to detect cases of MET exon 14 alterations, although recent clinical trial data presented by Dr. Kamage at the 2014 ASCO annual meeting suggest that patients with high levels of MET gene amplification also respond to MET inhibitor therapy. The exact degree of overlap between these two types of MET alterations, loss of exon 14 and gene amplification, awaits future studies, but current data suggests that both are candidate predictive biomarkers for therapy with MET inhibitors. There is now emerging evidence that patients with MET exon 14 alterations are responding to MET inhibitors such as crizotinib or cabozantinib, including objective tumor responses in this and other recent publications. Enrollment of these patients in clinical trials is paramount to understand whether different mutation variants respond similarly to MET inhibitors and will help define the duration of response to MET inhibitors. Enrollment of patients on clinical trials will also allow the determination of the mechanisms of drug resistance that arise at disease progression, a strategy that has led to the development of next-generation inhibitors or other therapeutic strategies in oncogene-positive cancers. Enrollment of patients on clinical trials will also allow the determination of the mechanisms of drug resistance that arise at disease progression, a strategy that has led to the development of next-generation inhibitors or other therapeutic strategies in oncogene-positive cancers. In summary, this article by Dr. Awad and colleagues performed an extensive analysis of more than 6,000 tumor samples and found that MET exon 14 alterations were limited to non-squamous, non-small cell lung cancer samples. This alteration occurs in approximately 3% of these tumors, and emerging evidence suggests that treatment with MET inhibitors can be effective in these patients. This oncogene joins a growing list of targetable alterations such as ALK, ROS1, EGFR, BRAF, and others in advanced non-small cell lung cancer. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.